As I start to think about turning 65, I know that I need to be informed about what exactly Medicare is and what I need to do. I'm here today to walk you through what I've learned. Before you get too concerned and overwhelmed, you should know that here in Minnesota, you don't have to live in the land of 10,000 Medicare questions because we have the Senior Linkage Line experts to help. You can call them at 1-800-333-2433 or chat online at minnesotahelp.info or visit them in person to discuss all your Medicare questions. Let me start at the beginning. Medicare is a health insurance program that for most people starts when you turn 65, but some people with disabilities are eligible at a younger age. You are eligible for Medicare if you or your spouse paid Medicare taxes for at least 10 years. Medicare has 4 parts that you should know about: Part A, B, C, and D. Part A covers such things as inpatient hospital care, skilled home care services, and some cases of short-term skilled care in a nursing home. Part B is medical coverage for doctor visits, medical equipment, x-rays, and lab tests. Together, Medicare Part A and Part B are known as Original Medicare. Most people who are eligible for Medicare will get Part A for free, so it usually makes sense to enroll in Part A when you're first eligible. However, Part B is not free. It has a monthly premium. So sometimes people wait to enroll in Part B, especially if they continue to work after they become eligible for Medicare Part B. Once you are collecting Social Security, you can have your Medicare Part B premium deducted out of your monthly check. If you aren't collecting Social Security yet, don't worry, you can simply mail your Medicare premium payment or have it automatically taken from your checking or savings account each month. It's important to know that Medicare doesn't cover everything. In fact, hardly any services are covered by Original Medicare at 100%. Most items require a copay, coinsurance, or a deductible, which you pay out of your own pocket. To help with these costs, you may want to purchase a Medicare supplement, also known as a Medigap policy. These are separate insurance policies that help to pay for the costs not covered by Original Medicare Parts A and B. And it's important to note that Medicare supplements do not have provider networks. Now, this means you can see any provider that participates in the Medicare program, and your supplement will pay. You can take the policy wherever you go. One other important thing about supplements is that they cannot cover prescription drugs. For that coverage, you need to turn to Medicare Part D, which I'll talk about soon. So that brings us to the third part of Medicare, Medicare Part C, also known as Medicare Advantage. These are plans that replace your Original Medicare Part A and B, and often Medicare Part D for an additional premium. Medicare Part C plans have to cover everything Original Part A and B Medicare covers, but they can require you to use specific providers, known as a network. Medicare Part C plans can lower your out-of-pocket costs, and some plans even offer coverage for additional services like dental, vision exams, and discounts on hearing aids. You can talk with a Senior Linkage Line expert about the differences between Original Medicare and Medicare Part C to understand what plans are best for you. Now we move on to the newest part of the Medicare program, Medicare Part D, which is prescription drug coverage. There are 2 different ways most people will get their Medicare Part D coverage: through a separate Medicare Part D plan or through their Medicare Advantage plan that includes Medicare prescription drug coverage. Whichever way you choose, these plans have an additional premium. Before I forget, there's one other plan option that's very popular in Minnesota that you should know about: the Medicare Cost Plan, which acts like a Medicare supplement but has networks of providers that can include Medicare Part D coverage and allows you to keep your Original Medicare Part A and B, which can pay for Medicare items not covered by the plan. To wrap things up with this Medicare 101 briefing, let's review one final important fact. Delaying enrollment in Medicare Part B and Medicare Part D can have serious financial consequences in the form of a lifetime of higher premiums if you do not enroll when first eligible. The exception is if you or your spouse are working. If you are receiving employer group health coverage, your Medicare issues become more complex, and the need for help from the senior linkage line becomes more critical. This is just a brief overview of Medicare. It's a complex subject, but we're very lucky in Minnesota that we have experts to help guide the way through the maze of Medicare. Print, phone, web-based. It's all here in Minnesota. You can receive a free copy of the #1 print resource, Healthcare Choices for Minnesotans on Medicare, which is an annual publication of the Minnesota Board on Aging. Minnesota also has the Senior Linkage Line, which offers free new to Medicare classes, Medicare updates every fall, and individualized help by calling them at 1-800-333-2433. You can also chat live with experts at minnesotahelp.info. Medicare help is just a call or click away.